Hi there, folks. Here for another fireside chat with Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta, an opportunity for you to ask questions about the COVID-19 crisis, the pandemic, and our response here in Alberta. So I know, Dr. Hinshaw, you just finished an update for the public just now, and thank you again for the great work you're doing and all of your colleagues at Alberta Health. And it's just tremendous to see the professionalism and how people are stepping up.
Thanks, yeah, and I really, as I said in my remarks today, there's really so many unsung heroes behind this response. We're working tirelessly, whether it's in health services, whether it's in social services. There's so many people who really should be celebrated and honored for the work that they're doing behind the scenes.
Absolutely. And amongst those are the folks in the charitable sector who are doing a lot in trying circumstances. A lot of the charities have seen their donations disappear. In many cases, volunteers not coming out any longer, or it's unsafe in some cases for them to show up. So I know everybody is under huge financial stress and anxiety right now, but if you can manage it, please consider maybe making a contribution to a charity of your choice that deals with, for example, the homeless, soup kitchens, helping with seniors, Meals on Wheels. There are so many good opportunities for us to show our caring Alberta spirit through volunteerism or financial contributions. So, Doctor, how do you think we're doing it at this stage in terms of containing the spread of the virus in Alberta?
So I think we've taken the measures that we've needed to take at the appropriate times, and I think we continue to evaluate the situation and have discussions with you and the Emergency Management Cabinet Committee. So I think, again, our response has always been to make sure that we're protecting Albertans from spread of the virus, but really considering the impact that has on livelihoods and right. the lives impacted by those measures. So I think, again, we've taken a measured approach, and we will continue to do so and continue to evaluate.
And I really want to commend Dr. Hinshaw for that, because she meets with our Emergency Management Cabinet Committee 3 or 4 times a week. It's a bit of a blur now, but sometimes it's every day. And we discuss some really challenging issues and policy choices about how to contain the virus. And I really appreciate that Dr. Hinshaw, based on the science of epidemiology, based on the data of where we're at in terms of infections here, also understanding that every decision has a downstream effect, a collateral effect, because we're not just dealing with the public health crisis here, but 2 concurrent economic crises, one being the recession created by the COVID-19 pandemic around the world, and another by the collapse in oil prices. Now, those 2 things are related, but the bottom line is they mean a period of quite profound economic adversity for us here in Alberta. So if you have questions for me in part about the economic or broader governmental response, I'm happy to respond to those. And Dr. Hinshaw is available to take your questions on the public health aspect of our actions. So the first question goes to Cheryl Bishop, and I see this a lot on Facebook actually, Doctor, and she's asking, are we going to a lockdown? I think by that she means shutting absolutely everything down.
Right. And I know people are watching the news, they're seeing what's happening in other provinces and other countries. And so we can see across the country, different provinces have taken slightly different measures depending on their own situations, their own epidemiology, and their own unique kind of considerations that they have with respect to geography, population, that kind of thing. And so some provinces have taken more stringent measures than others at different times. What I would say to that is that in Alberta, again, we want to make sure that we're balancing the needs of the population from all aspects, including the risk from the virus with the risk from the actions that we take. And so it's possible that we may be bringing forward recommendations if we think that they're appropriate to put more limitations in place. I don't anticipate that we will be if by lockdown you mean every single business is shut down and people are required to stay in their homes and not leave at all, I don't see that in our near future. Again, there may be additional measures we do need to take, and those will be taken, again, weighing the risks of the virus against the risks of the actions.
And, I saw yesterday, I think while I was doing a news conference, there were hundreds of comments or questions like that people asking for the government to shut everything down. And folks, I just want you to be assured that we will follow the very best public health advice, and that comes from our chief medical officer, but she's supported by a team, and they are constantly analyzing the data, looking at new research coming out about the characteristics of the coronavirus, about the spread in other jurisdictions. But both our public health folks and the government have to consider all of the impacts. Let me be very transparent. There are going to be negative health, mental and physical health implications as a result of the recession in which we're now headed, and so we need to keep those factors in mind as well as part of the broader responsibility that the government has and our public health agencies have to consider all of the social impacts of what's going on. So next question would go to Susan Murphy, who says, Dr. Hinshaw, can unwell self-isolating individuals go on walks in their neighborhoods?
So I've spoken before about the fact that people who are self-isolating and feeling well can go outside, can go for walks as long as they stay 2 meters away from others. If someone is not feeling well, then it may be best for them. They can certainly go outside on their back deck, they can go into their yard, that's not a problem at all. They may not want to go too far from their house though in terms of going for a walk in their neighborhood. Just again, if people are feeling unwell, it's probably better for them to stay close to home. Even though certainly if they stay 2 meters away from everyone else, then the risk would be very small. But the chance of running into someone you know who wants to say hello, wants to come up to you, then that risk is greater if someone is feeling unwell. So my advice would be for those who are sick to stay as close to home as possible, but being outside in the yard, being outside on a balcony or a deck is not a problem.
Thanks, Doctor. So Sean Conway says, I'm in construction. For how much longer will we be working? So over to you. If you want, I'll maybe supplement the answer.
Sure, yeah. And I think, there's lots of people in different industries who have that same question. Again, that concern about, are we going into lockdown? Will everything be shut down? And again, what I would say is that all of the recommendations that I make that come from work that I do with the team to look at where we think that we need to go with respect to reducing the chances that people are exposed to the virus, all of those are taken, we take into account the societal impacts of those measures as well as the public health impacts. So with respect to construction sites, we've been clear that our recommendations for the limitation on a gathering of 50, that's for specific, say, social gatherings within a confined space. But if construction workers are 2 meters apart, and if it's a large site, then that doesn't apply to those construction sites with respect to having only 50 people, for example, on a construction site, because there are measures that can be put into place to reduce the chance that there's transmission. So I'm not making a recommendation to close construction sites, and again, that would be based on weighing out the risks and benefits, wanting to reduce transmission, but my understanding is that those risks can be mitigated through other measures on places like construction sites.
And by the way, Sean, the government is working on developing a list of what we will designate as both critical infrastructure and essential services. So should Dr. Hinshaw come to the government with a recommendation to suspend non-essential services, we would then know which essential services we could keep operating. I mean, there's lots of different ways of doing that, but our view, I think that, as you've just heard from Dr. Hinshaw, our view and the view of most other jurisdictions around the world is that construction sites can generally continue to operate safely with appropriate hygiene protocols in place. Because they are outside, there's not people in close quarters inside. So I think it's fair to say that generally speaking on a construction site, if they follow the proper protocols, the risk of transmission can be reasonably low.
That's right.
Yeah. All right. So next question goes to Amy Stahl, who says, what about groups of 50? Shouldn't it be changed to 10?
So the number of people who are permitted to be together in a gathering, as you know, is 50 at the moment in Alberta. Other provinces have changed that to different numbers. What's really critical about any number that we pick, and we're certainly looking at that, looking at the evidence, looking at, again, our numbers, as well as the experience that other provinces have had. One of the critical things is that the number is only part of the equation. What's also important is how big a space is and what people are doing in that space. So if you have 50 people in a football stadium and they're all very far apart and they're not interacting with each other and coming into close contact, then that would probably be less of a risk than if you have 10 people in a very small room who are all very close to each other. And for example, if you have a party and you have 10 friends over and they're all in the same room and they're sharing a common bowl of snacks, then the risk would be higher for those 10 people than for 50 people who were spaced well apart, with no one sick, with good hand hygiene, and all of those measures in place. So as we look at the number, we are also looking at the measures that need to be put in place. And so both of those things need to be considered when we put any additional guidelines or recommendations that we may have. Both pieces need to be considered.
All right, thank you, Doctor. So Gregory Ambrosi says, what is the game plan for isolating seniors that have come down with the virus and getting them the support that they need? How frequently are the seniors' care facilities being tested for COVID-19?
So with respect to seniors who are finding themselves needing to be isolated at home, and that could be because they've returned from traveling and they need to stay at home for 2 weeks. It could be because they perhaps were a close contact of someone who has COVID-19, or as in your specific question, if they themselves have the virus and they're feeling ill. So there are certainly different avenues for those people to get support and help. We're really encouraging, in addition to the measures that are being put in place with respect to making sure that in formal care settings, so somebody who's on home care, for example, making sure that their home care teams know exactly what to do, and that any of the formal supports they have are able to support them through whatever circumstance they may be in. We're also really encouraging our informal networks, as the Premier mentioned, with respect to civil society groups, organizations like Meals on Wheels, other organizations that are able to support seniors if they are needing to be isolated, that all of those are an important part of the fabric, and that we all really need to pitch together, and people can even think about their neighbors or friends who might be seniors, who might be even proactively self-isolating. Perhaps they just don't want to go out because they're worried that they don't want to become in contact with the virus. There are things that neighbors and friends can do, like getting groceries for them and that kind of thing. So I think, again, we all have a role to play in making sure that we pitch in. But for a senior who specifically has been diagnosed with COVID, public health would be in contact with them, making sure that their symptoms were being monitored, that they had appropriate supports, that they were still feeling well enough to be at home. And if they did start to feel worse, then if they needed to be in hospital, then that's where they would be transferred to. There was another question about the testing in seniors' facilities. And so for several weeks now, we have been making available tests for anyone who has symptoms, so whether that's staff or residents of long-term care facilities. Any staff or residents who have symptoms of cough, fever, runny nose, sore throat have been eligible for testing, again, within these facilities, because we know these are very high-risk places, and that testing continues. So we want to make sure that we catch any diagnosis of COVID-19 as early as possible and put measures in place to prevent its spread. And you may also know that effective yesterday, we did start requiring that all long-term care, continuing care, and seniors facilities, lodges, that there is a daily requirement. Any staff or anyone who's coming into that facility to work does need to be checked. Any residents who've left and are coming back, there needs to be a symptom check. And if they're feeling at all unwell, then a resident would need to be staying in their room away from others, and a staff member would need to find a replacement and wouldn't be able to work if they were sick.
Thanks, Doctor. So the next question is from Leanne Jacobson. She asks, are you concerned about the spread of the virus in the USA, being our closest neighbor? Maybe I'll take the first stab at that. I am concerned because it does appear that parts of the United States have a much higher level of infection than we've experienced in Canada, particularly some hotspots in the coasts like New York City, and north of Seattle, some parts of California. So we don't see that high level of outbreak in like Montana, just south of our international border with the USA. But and secondly, we should be mindful that the two governments, Canada and USA, have agreed to limit travel between the two countries to only essential visits. So, and thirdly, I will say that we have the government of Canada has finally stepped up, I believe, their screening and their kind of monitoring of the border to more. They've done, I think, they're doing a stronger job of trying to detect symptoms, for example, and of requiring Canadians coming home to give an attestation that they will go directly into self-isolation for 14 days. Now, we have deployed Alberta Health Services personnel to all of our ports of entry. Those would be the international airport arrival areas as well as the main land border crossing at Coots. And they are there to provide support to Public Health Agency of Canada personnel as well as the Canada Border Services Agency. And we continue, our provincial government is monitoring that very closely because of, I share your concern, Leanne. I guess here's my concern. In a worst case scenario where the United States loses control of the situation, if you were to see really wide scale sort of Spanish or Italian levels of infection, I am concerned that in that kind of scenario, I think it's conceivable that some Americans would want to try to kind of flee to a jurisdiction like Canada with a much lower, which appears to have a lower level of infection and a stronger ability to cope with its healthcare system. So that is a concern, and that's why I support the federal government's more stringent access. By the way, foreign nationals, which basically means foreigners, are not allowed to enter Canada, and with the exception of Americans, and for them it's only if it's an essential visit. And some of that is obviously necessary. I'll give you an example. We obviously need the truckers to continue to operate because most of the food in our grocery stores, or much of it, is sourced from the U.S. and south of the border, and so our economies are so closely linked. We don't want to completely close that border. Do you have any additional comments on that, Doctor?
I think that covers everything that I would have said. Yeah.
All right. Next question is to Lisa Hintka, who says, is there an isolation requirement for interprovincial travel? So I guess I'll take that. There is not an isolation requirement for interprovincial travel, and I think we generally advise people to avoid traveling, only to travel if they absolutely have to for work-related business. Truckers are a good example of where that is essential. And I'm sure the doctor would say that if you are going from one province to the next, be very mindful of your health to see if you have any symptoms. But there is no isolation requirement. I will say that some jurisdictions, for Albertans going to the Northwest Territories, they're now doing screening at the border, as are New Brunswick and Nova Scotia. But here in the West, we have not done that. Any further comments?
No, I think that covers it. I would reiterate, though, your comment about making recommendations at this time that people not travel even within the province, but much less interprovincially unless they have to.
All right. Next question goes to Phelan Broderson-Kuzov, who says, do we have enough supplies for medical facilities to weather this, like PPE, that's personal protection equipment, cleaning supplies, and hand sanitizer? And I think we both need to speak up. We're getting some complaints about people not hearing us.
Oh, okay. So maybe I'll start with this one, and just to say that at the moment, there's no shortage of PPE, of hand sanitizer, cleaning supplies within our medical facilities, particularly within Alberta Health Services. And Alberta Health Services is working with primary care networks to help family physicians with PPE, personal protective equipment, as well as our seniors facilities. We know that if we anticipate that we'll need to be in this response for a while, so there's lots of work underway to make sure that we have good, robust supply chains for those resources, and particularly things like hand sanitizer, looking at ways that maybe we can start supplying those or manufacturing those within the province, And I think, again, at the moment, there's no concerns, and we are working, Alberta Health Services is working on that. We're working on that with respect to personal protective equipment, not just for health services, but for other sectors with our Provincial Operations Centre. And again, looking at all opportunities for local industry to help support some of those needs. I don't know, Premier, if you would comment on that.
You're bang on, Doctor, as usual. I'll just add that AHS has done a great job of planning for an event like this. So they have a very large warehouse stockpile of that kind of equipment, and they believe that they have enough to deal with the pandemic at its projected peak. But they don't have surplus equipment to give to everyone else in our society. So I've tasked our Deputy Minister, who is responsible for emergency planning, General Paul Winnick, with sourcing things like personal protection equipment and hand sanitizer, cleaning equipment, cleaning supplies, to make that available to folks as a backup source for the health system should they need it, but also to make it available to essential services operating outside the healthcare system. So that would include, for example, police, firefighters, people working in homeless shelters, in soup kitchens, and many other critical jobs in our society. So we've got sort of AHS, we think they've got what they need, but we're working, and on that, there's, as Dr. Hinshaw mentioned, we're working on getting some of the stuff supplied internally. I want to thank distilleries and breweries across the province, many of whom have converted, because they're not selling a lot of beer right now, they've converted to producing hand sanitizer. And so we're working to connect those initiatives with organizations like charities to get that hand sanitizer into the hands of folks that need it. All right. Caitlin Lees Ann says, can you please talk about shutting down the personal services?
So personal services, as I understand it, so I'll hope that this is the way that Caitlin meant it. So personal services are typically those services that are provided often one-on-one, like hairdressing or aesthetics, so facials or nails, those kinds of things. And that's something that we've been looking at. We know other provinces have looked at that sector as a concern and have taken steps to close it down. We, again, have been making sure that we're looking at our own epidemiology, looking at the risk levels in the province, and weighing the impact. We know that any sector that we move to restrict, that there will be a significant impact on people's livelihoods, and we don't want to make that move in advance of when it's needed. So again, we continue to closely monitor the situation and look at a time. There may be a time when we consider it necessary to close down those kinds of businesses. We haven't reached that time yet, but we are looking at that option, again, knowing that these kinds of establishments are not possible for people to maintain 2 meters of distance. So we have been really emphasizing the importance of making sure that any workers in those facilities and any patrons or clients who come have no symptoms, that there's screening that happens, that there's posters at the door, that there's regular cleaning of all high-touch surfaces, regular hand washing, all of those measures to make sure that the risk is reduced in those settings. But again, we know that there may be other measures required in the future, and we continue to look at that very carefully.
All right. So, and by the way, there's so many people who've lost their jobs in the past 3 weeks. In particular, it is a time of just great financial anxiety and challenge for so many people. And my heart goes out to those struggling small entrepreneurs who might be hairstylists, have their own small salon, or they just have a chair in a barber shop or a salon or in an esthetician's shop. And these are folks that they don't have any kind of guaranteed income. They don't have any backstop. And so folks were very concerned. The Government of Canada yesterday announced a second expansion of the employment insurance program, including for the self-employed, like many people in those personal services industries. So I'll ask our team to please put in a link below in the comments section a link to the information on how you can apply for employment insurance benefits for the self-employed, so that you know that there is access to some income over the next couple of months. All right, Mallory Christensen says, what are we doing with the shelters and how are we keeping homeless safe? So I'll take that one on, Mallory. Thanks for your concern for our homeless population. They are uniquely vulnerable at a time like this because, as you know, in emergency shelters, people tend to sleep very closely to one another. It's very close quarters, and it's an environment where germs and sickness can spread very quickly. So we're super concerned about that. And in fact, at every single meeting now of our Emergency Management Committee of Cabinet, we are discussing what we can do to reduce the risk of viral spread in the homeless shelters. I personally have visited a couple of our homeless shelters. Our Minister of Community Social Services, Rajan Sani, has done that as well. We provided $25 million of extra funding to the shelters 2 weeks ago when the pandemic first started here in Alberta. And that money is being used to open up overflow shelters to reduce the population density in the shelters, to let people space out more. Alberta Health Services is sending health inspectors into those shelters much more frequently to ensure that people are sleeping far enough apart. Here in Edmonton, we've helped to rent out the Expo Centre. I want to thank Mayor Don Iveson and the City of Edmonton for their participation in that. That is a overflow site for shelters. Hope Mission is also using some church facilities for overflow. Down in Calgary, there are also overflow shelters being established as we speak through both the Mustard Seed and the Drop-In Center, and they are working with other social service organizations like the Alex, for example. And that then there's the In From the Cold in Calgary is a family shelter, and I'm pleased to tell you that all 20 families who are staying there have found space, that we've helped to help find them space in apartments. So first of all, there's that spacing out. Secondly, Alberta Health Services is stepping up its support for personal protection equipment as well as screening. Now, we cannot do a coronavirus test for every single person in the homeless population because we just don't have that many tests to go around. But anybody who appears to be symptomatic can be referred for testing, and there is more screening going on. Finally, we're setting up shelters for quarantine and self-isolation. So we see people with symptoms, we'll send them to a separate shelter facility where they can be properly isolated away from other homeless folks. And if they are confirmed to have COVID-19, there will be quarantine facilities available for them. So we're following this very closely. Anything else to add?
I would just add my voice to yours, Premier, to say thank you to all those who are working in those shelters. And often we focus on the healthcare response to this virus because it is significant. But certainly all of the workers at every level who are working in these settings with these people who are vulnerable, just want to say thank you and reiterate my point that the unsung heroes behind this response are really those at the front lines doing this challenging work of keeping people safe, especially those who are vulnerable, like those who are experiencing homelessness.
Thank you. And Zach Odland has a question. Are you planning on shutting down day homes, accredited and private?
So we've worked with Children's Services Ministry to provide advice and information on how day homes and those daycares that are open for essential services workers can operate in a way that reduces the risk of transmission of virus as much as possible. We know that children often, if they do become infected with the virus, have very, very mild symptoms. And so we want to make sure that there's regular screening in place, that someone who brings their child to that particular day home or daycare, that they're checking their child and that the person who's running that day home checks that child for symptoms when they get there. We don't, at this time, think that there's a need to shut down those day homes. However, it's really critical that everyone is following those guidelines and that standard that's put in place, because we know that although children often have very mild symptoms, they can then introduce it to other members of their family who may become more seriously ill. So again, it's really about following those recommendations and guidelines in all childcare settings.
Thank you. So Siobhan Conway asks, my husband is in the oil and gas industry. If there's a lockdown, will oil and gas be shut down? The simple answer to that, Siobhan, is probably not. It depends on what kind of job in the oil and gas sector. But I can tell you that, and I've said this publicly, we believe that much of the operations in the oil and gas sector constitute an essential service because it's so core and central to our economy, especially the SAGD projects up in the oil sands, because they basically cannot stop operating. If they stop operating, the reservoirs seize up, and that means that can jeopardize the entire reservoir and billions of dollars of assets, which are of a critical importance, not just to Alberta, but the entire national Canadian economy. So we're going to do everything that we can to keep operations like that moving. We're working very closely with the oil and gas companies. We are providing greater support to the camps that operate up north to ensure that they are rigorously following all of the Dr. Hinshaw's health protocols and all the proper hygiene rules. And so we're going to do everything we can to keep those kinds of jobs operating. By and large, we're talking about outdoor jobs where people are not in super tight conditions next to each other. And so the answer is, we hope to be able to continue operating in that part of the economy as much as we possibly can.
Yeah.
Okay. All right. Randalee Groenveld says, how did COVID-19 come to Canada? How long did this go on for? Or excuse me, how long can it go on for?
So COVID-19 has come to Canada through spread in other countries. What we've seen in Alberta is almost half of our cases that were travel related have come to us from the United States. And certainly we've had other cases that have come from other countries around the world. But essentially what happened, as everybody saw unfolding over the past several months, is that in China there was a combination of the virus that was able to move from likely a bat, is what most people believe, potentially through some other intermediate animal host and then into people. And the virus, through that movement, it became able to spread from one person to another. And so as that happened, we saw this unfold in China, where it spread relatively quickly in the area where it likely originated. And then the Chinese government put measures in place to prevent the spread. But because the virus had already spread, because again, many people who have this illness have a very mild illness. So it was only when enough people had severe illness that this was identified. And unfortunately, this happened at a time when many, many people were moving around the world for Chinese New Year and going from that center where the virus originated, where it jumped from animal to human, that people had already traveled to multiple places around the world. And so in many, many places, those cases that came from China were identified. So in British Columbia, for example, or in Ontario, some of their cases, the first cases in Canada, did come from that location. They were quickly identified, they were isolated, and everything appropriate was done to stop spread. But unfortunately, in some other countries, there were cases that ended up spreading within those other countries and that was not detected. And then from those other countries, we started seeing more people coming back to Canada and to Alberta, having been infected by the virus. And again, in some cases with a mild illness. And people didn't know that they had been exposed to COVID-19 because they were not traveling in areas that we knew at that time to be at high risk. So for example, the United States. And so we ended up getting some of those people coming back without knowing it and potentially spreading, which is why several weeks ago we expanded our testing protocols to include anyone who traveled from anywhere outside of Canada. And that's where we found the majority of our cases to be. So that's sort of the story of how it came to Canada, was really a spread in other countries around the world and then into Canada. With respect to how long can this go on for, this is a virus that's new, so none of us around the world have had previous exposure or have had previous immunity to it. So unlike viruses like influenza, even though they change from year to year, we've all been exposed to influenza at one point or another in our lives. So while it shifts, we have some baseline immunity to that we boost with our annual vaccines. But with this new coronavirus, none of us have immunity. So how long it will go on for depends in large part on how we respond to it. What we're doing right now is trying to limit the spread of the virus so that as few people as possible are transmitting it, so that we don't have a big surge in cases all at once that overwhelms our healthcare system. But we know that until we have a vaccine, we won't be able to stop its spread completely. And so what we need to do is to lower the spread and learn from countries that have been successful in maintaining kind of barriers to spread around people who've been identified as cases and their close contacts. So our testing strategies and our contact tracing and our self-isolation of close contacts of cases, those are the critical pieces of our response. And the other measures we're putting in place are important layers on top of that to slow down that spread. But this will likely go on for many months in terms of the spread of the virus. That doesn't mean that all of our measures will need to be in place for that whole time, but we do need to have these measures in place right now to slow the spread, and then watch to see how successful we're being, and potentially then ease off some of the measures as we're able to increase our capacity for doing more of that contact tracing and isolation around identified cases.
And actually, a related question coming now from Avanish Kotkar, who says, are we working on inventing vaccines for COVID-19?
So yes, there's a lot of work being done on vaccines around the world, and there are different organizations in Alberta, different university research projects that are going on with respect to vaccines. And that's true across Canada and around the world. There are many, many different teams that are working as fast as possible to try to get vaccine candidates. There are some places that have started trials of those vaccines, but because this is a completely new virus, we don't have a vaccine. So I'll give an example of influenza. In 2009, we had a pandemic of H1N1 influenza, which was a new strain of influenza. But we make influenza vaccines every year, and so what we needed to do for that was plug in the new strain to our pre-existing process. And we don't have that with coronavirus, so it takes longer to get a vaccine developed. And even if these early clinical trials are successful and they show that in small groups that the vaccine is effective and safe, we still would need to do larger trials because we wouldn't want to offer a vaccine to the population without rigorous safety testing. And then it also takes time to have large-scale production to make enough vaccine for everyone. So the estimates in terms of availability are likely to be approximately a year from the time this virus was first identified back in January. Unfortunately, it's unlikely we'll have a vaccine much sooner than that, and it could take a little longer.
All right, next question to Tanya Douglas, and she asks, is there any financial help for self-employed who don't have COVID-19, don't have kids, but have lost over 70% of their income because of the virus? Perhaps you're describing your own situation, Tanya, and there's a lot of people in that situation. The answer is yes. The Government of Canada, with encouragement from provincial governments, has announced a very large expansion of employment insurance to include the self-employed. I think it's a $4,000 a month payment. I haven't yet been briefed on the details. It was just announced yesterday. The second part of it was announced yesterday. Again, I'm going to ask my team to post a link in the comment section below to the federal announcement, and that the federal government assures us it is there. That payment is there for the self-employed. Then we have a related question from Mark Gantley, sorry. I was unable to find work and my EI ran out. Is Alberta going to set up benefits for us who may not be qualified for EI? The answer is a qualified yes, Mark. First of all, we've set up an emergency isolation payment. If individuals have had to go into self-isolation and leave work, for example, because they are feeling sick or they have coronavirus or they've recently traveled from a foreign country, we are offering payments of $1,146, I think it is, over 2 weeks. You can apply for those if you qualify at alberta.ca, excuse me, and we'll put a link on that below as well. We had some technical problems today, folks, with our emergency isolation payments because the system got crashed, overwhelmed with applications. Service Alberta is working to fix that as quick as they can. But that may not respond to your situation, Mark, because it sounds like you may not be self-isolated. Look, at the end of the day, Alberta has a program called Alberta Works, which is income support for people who have no other source of income and who no longer qualify for EI. And we are looking, Mark, at easing the qualifications to receive the Alberta Works benefit. You know, for example, one of the requirements in the past has been that you look for work in order to achieve it. But obviously, in this economy, for at least for the next few months, it's going to be really tough to find a job. And I'm just being blunt. So we may temporarily remove that to make it easier for folks in your situation to receive at least that basic income. All right, Alicia Moon says, what is the age range of the people who are currently in ICU? How many of them have underlying conditions, doctor?
So I don't have all of the ages of those in ICU in front of me at the moment, but I do know that they do vary widely. So there are people from their 40s to their 80s in ICU. And of those who are younger, the cases that I've been informed of are individuals who did have underlying medical conditions. However, these were conditions that were relatively stable. So even though they were younger, they weren't in kind of critical situation before they became infected. They did have, again, some of those risk factors of pre-existing medical conditions. But again, this virus is very serious, and we need to all make sure that we're doing our part to prevent people from getting infected with it, because as we can see, we have 10 people, as of today, 10 people are in the ICU. And again, it is all age ranges. We just need to make sure that we're taking this very seriously.
Thank you. So CM, I think it's Callis, says, why do you think numbers are so low in very south parts of Alberta, like in Medicine Hat, Lethbridge, compared to other cities of that size?
So I think that's a function potentially of our testing. You know, we have been testing people who've come back from international travel, really focusing on that. And so I'm not sure that there have been as many people returning perhaps from international travel. I don't know the stats for all those different cities. I know that Calgary has more returning travelers from international destinations than Edmonton does. And that's one of the reasons that I think we see more cases in Calgary than Edmonton. But if you look at the numbers with respect to, we do have a map that shows some shaded geographic areas of where we have cases. It wasn't my memory that Lethbridge or Medicine Hat were significantly different from, say, Grand Prairie, Fort McMurray, or Red Deer. So I think it is just a function, again, of returning travel volume. And I will underline, though, that these numbers are what we know of, but we do know that we have had, as of today, 33 cases that seem to have been picked up through community transmission. And the majority of those were in Calgary and Edmonton at this point. But I think every city in the province needs to prepare, because this is a virus that spreads very easily through, again, coughs and sneezes when you're within 2 meters of someone, and particularly seems to spread very easily through contacting contaminated surfaces and then somebody touching their eyes or their mouth. That seems to be a way that this virus spreads quite easily. So with that easy spread and people who have mild symptoms, I believe that every city in the province should be ready to have cases in their city. And again, be taking all of these precautions right now and not waiting to see those cases come up.
So remind us what the rules are. Wash your hands under hot soapy water for at least 20 seconds frequently.
Yes.
Avoid touching your face. If you feel sick, stay at home
Yes.
for at least, what we're talking, 10 days?
Correct. 10 days from the start of illness, or until you feel better. So whichever is longer. So if you're feeling well before 10 days, still wait out that 10 days. But if you're still feeling sick, you should wait until you're fully well before you go out.
Stay at home if you can. Avoid large crowds, obviously. Avoid traveling unless it's essential. And if you're traveling from outside of the country, you have to go into self-isolation for 14 days. And that, I've said it before, I'll say it again, that does not mean you take the RV and you stop and go into a restaurant and you just go into the grocery store and you visit the grandkids, you go pick up the dogs at the kennel. None of that. You go straight home. If you arrive at the airport, the government of Canada now has new quarantine rules around that as well. You go straight home, and you need to have other folks help you get supplied if you're coming home, like as a snowbird, for example. So that's a summary of the rules?
That was great.
Okay,
Yes.
all right.
Yeah.
So Chris Fedun says, is it worth looking at test kits that can be mailed to Albertans? Where can we self-swab and then drop off in secure locations for pickup?
So we've had lots of different companies sending suggestions. There's lots of different technology that's being developed right now. There's a huge demand for testing. And so I would say that Albertans at the moment need to be cautious. So if there's something available online that promises to be a self-swab kit that will give results in minutes, I would be cautious at the moment, because many of these companies still need to go through a validation process. They need to prove that these testing kits actually work the way that they are promised to work. And I would say that we're looking at all options for testing, because I personally believe that our ability to expand our testing, combined with our ability to do contact tracing and put measures in place to prevent spread, is a critical backbone of our response. But at the moment, again, we need to make sure that we're not rushing to get technology or test kits that haven't been fully validated, because a false negative or a false positive test result can have devastating consequences. So it's really important to make sure that we ensure that every bit of these testing technologies is validated before it's rolled out. But I will tell you again that we are looking very carefully at all options that are available, because this testing is a really critical part of our response.
All right. Last question is from Lori Fitzhibbert, and she says, if we know of someone that should be self-isolating but isn't, what should we do?
So, very common question and a good one. I think first of all, it would in some part depend on who that person is and whether they know they need to be self-isolating. So if it's someone that you know well enough to have a conversation, reminding them that this is critical, and self-isolating is a life-saving measure for other people, because sometimes when symptoms start, they can be quite mild. And so someone might feel well in the morning, but then they go out to their workplace or to a social event, and while they're there, they might develop symptoms, and that potentially exposes others. So again, reminding people, this is really, really critical. If that reminder or potentially offering support, the reasons that they're not self-isolating might be that they don't have a way to get essential groceries or other services. So is there a way to connect them to supports that are available locally? And if all of those measures are exhausted and it's still somebody who is really saying, no, I don't think this is appropriate, I don't want to do it, there is a form online at Alberta Health Services where concerns like this can be registered, whether that's an individual who isn't self-isolating or whether that's a business that's not responding to the measures that are put in place in terms of limiting people from attending, say, a bar or a nightclub or something like that. All of those complaints can go to that Alberta Health Services website. You can find that by looking for Alberta Health Services Environmental Public Health. I think a link maybe will be posted here so that you can link directly to that. And there will be then an investigation and follow-up of that concern. The final thing I'll say is that we did speak with all of the health regulatory colleges, and if someone is a member of a health regulatory college and they are not self-isolating, then you can put a complaint in directly to that regulatory college, and the college will follow up with that member to ensure that they're following the advice, because that is their obligation as a regulated health professional to make sure that they are not putting members of the public at risk.
All right, so we're going to have to wrap up there because both Dr. Hinshaw and I have a lot to do, as you might imagine. Thank you very much, folks, for your good questions and for all being in this together. I think this is, as I've said before, an opportunity for us to look out for each other in so many ways, and the conduct of everybody can affect the health of everybody in a situation like this. And that's a message we just need to keep driving home as we do everything we can to keep Albertans healthy. And I can assure you that at the same time, the government of Alberta is doing everything we can to respond to the time of real economic adversity into which we are now headed. We'll have more news about that in the days to come. So thanks very much, and have a good evening, everyone.